Hi everyone, Dr. Jenny Brown at NRM in Vermont, and today we're going to talk about unexplained infertility. So you might have received this diagnosis and feel frustrated or confused. Essentially, it sounds like it's not a diagnosis, but it in fact is a true diagnosis that is common, and I would say affects 40 to 50% of all the patients that I see. And what unexplained means is that we know there's a factor, that there's something going on, but we can't define it specifically. So for example, we have done a semen analysis and know that the sperm count, motility, and morphology are all adequate. We have done an ovarian reserve assessment of the eggs and have seen decent quantity, meaning the AFC is maybe 10 or 15 or more. That's the antral follicle count on ultrasound. And your AMH is about 1 to 1.5 or more. And then we've also done an anatomic assessment and determined that the uterus is normal in appearance and that the tubes are open and patent, meaning that the egg and sperm can meet in the tube as designed, and then the embryo can travel to the uterus. So when all these things appear to be right, however, you've still been trying for a year or more if you're under 35, or you've still been trying for 6 months over the age of 35, then we have a diagnosis of unexplained infertility. And we have a lot of good research and studies on how to treat this. And generally, when you're under 38, the first step is to start with a therapy called Clomid and IUI, or insemination. So with this therapy, what we're doing is we're optimizing your ovulation. We're potentially getting you to ovulate more than one egg. So it's like having 2 eggs released at once. So it's like having having 2 tries in 1 month. And then we are teaching you how to administer a trigger shot so that you ovulate strongly at a specific time, and we coordinate that with an IUI, or an intrauterine insemination, where we're getting the sperm past the cervix, which is the trickiest part for the sperm, and into the uterus right when we know you're ovulating. So with this therapy, we know that we can about triple your success per month. With a diagnosis of unexplained infertility, your success per month is about 3%. This is not compared to 100%, but this is compared to the most fertile couple who's just started trying. Heterosexual couple would have a chances of about 22 to 25% a month. And so after trying a year, you're at about 3% a month, and then with Clomid and IUI, you can boost that back up to about 10% a month if you're under 35. Age really affects the success, so the age goes down as you get older than 35, and that's where IVF comes in. At 38 to 40 plus, sometimes we skip IUI, sometimes we start with IUI, but sometimes we fast track to IVF or in vitro fertilization. And this treatment really works for unexplained infertility because essentially we're taking your whole group of eggs for that month and fertilizing and creating embryos. So it's like getting a whole year's worth of eggs all in 1 month. So we might get 10 to 15 or more eggs, fertilize them, make 3 to 4 embryos, and then we have each of those as embryos as a chance of success in what we call an embryo transfer. So IVF really enhances success by taking things out of your body, taking them into the lab where we have control over the fertilization, and making embryos to give you the highest chance of success. The success with IVF for women under 35 is about 40 to 50% per embryo transfer when the embryos are not tested. And remember, that's compared to the Clomid and IUI success of about 10% a try. But we can also do something called PGT testing on embryos, where we are trying to select for the chromosomally more normal, or what we call euploid embryos, and that can increase your success to about 60 to 65% per transfer. So these are all treatments for unexplained infertility where we don't have a specifically identified problem, but we're maximizing your chances at success each month. And if you want to learn more, I know that's a lot of information, but don't hesitate to contact me at drjennybrown@nrmvt.com, or set up a telemedicine appointment and we can talk about your particular case and what you've tried and what your goals are and get you going. All right, thanks. Have a good day.